this morning, we're joined by our guest, who is a president-elect of the National Association of Resident Doctors, Dr. Ogar Emmanuel Idoko. Good morning to you, Doctor. Thank you so much indeed for joining us this morning.
Yes, good morning. How are you doing today?
Very well. And how are you?
I'm fine. It's so good to be here.
All right, let's get the conversation started. The ultimatum by your association, August 10, you've set as a deadline. What exactly still hasn't been resolved? And realistically, how close are we to another nationwide shutdown of public hospitals?
Okay. Before we start, let me correct an anomaly. 10 years ago, we were over 25,000 doctors.
Not 15.
Not 15,000. No, not 15,000.
All right.
We were over 25,000 doctors, and then 10 years after, we are less than 15,000.
Okay.
Across the 91 centers in Nigeria, which is actually very abysmal. If you look at the statistics, in 2016, we were over 24 or 25,000. You understand? Over 4,000 doctors left Nigeria last year. 3,900 left Nigeria in 2024. Over 2,000 just left Nigeria just within this quarter of the year, which is actually very abysmal. What we are asking for, we are not asking for too much. You understand? We are asking that the system should set their goals right. A situation where you're a doctor in a teaching hospital, we're not just fighting for our remuneration. We are fighting for other things too in a hospital. I don't know if you understand me. Can you hear me?
What are these other things? Can you enumerate them?
Because of our strike, with respect to our strike, our demands are substantial. Our demands are numerous. I'll just mention a few. You see what we call the PAT, professional allowance table, where doctors have been changed since over many years ago, more than 15 years ago. The federal government agreed that we should come to the round table and discuss on how these issues will be sorted. We signed MOUs upon MOUs. We've met more than 20 times to discuss on how these issues will be sorted. The PAT area that was supposed to be paid has been abandoned. Promotion areas for doctors since 2021. These people sat for exams. They are medical officers in all hospitals in the country. They sat for exams. They agreed that after these exams, you will pay them. For more than 6 years, they've not been paid their promotion areas. You move to salary areas for other centers like IFE, OHS Complex IFE, centers like Federal Medical Center Otopo, and other centers too. People who work, you employ them for more than how many years they work for. Some of them, they're earning them 18-month salary areas. These issues are very simple. How much is it? Less than 400 million. Why not you just pay them so that we can abate this recurring menace? We have other issues too. The MRTF was paid just last month or so, but we have some persons that have not received. We've written to the Federal Minister of Health. They're actually working on it. We commend the Honorable Minister of Health because they are working on that. We're hoping that will be sorted this week. Center like Lut, they're on strike because of what we call me. How the doctor go to work, you go to work, you work for more than 24 hours, just for the CMD to give you what we call me, so that you will not leave the hospital and go searching for food or what you eat. And then the CMD is telling you that he does not have resources, he does not have money to sort out. Just call me, which is not substantial. You move to other.
Yeah, go ahead.
You move to issues of infrastructure too. You move to issues of what we call burnout. 10 years ago, as a junior resident, you have more than 7 persons working with you or 9 persons working with you in the same cadre as a junior resident. 10 years after, you just have 2 persons working with you in the same department because of what the continuous migration of doctors living in droves in Nigeria. Nigeria is the
there are a couple of concerns I have, Doctor, because I'm glad that you acknowledge there's been different engagements with the government, negotiations, and in fact, signing of MOUs on this particular issue, some of the concerns you raised around allowances and so on and so forth. And one of the reactions to the federal government to all of this issue is that those negotiations have been heavily fragmented. That we have the different health unions, who would always come to governments to make demands on certain things, and there doesn't seem to be a uniformity with, some of these demands. So today, NARD comes to say, look, you have to do so and so number of things. Tomorrow, Johesu comes and says you have to do this and do this and do that. And then the very next day, another health union comes again with their own demands. And I mean, the stance of government is saying, look, can we aggregate all of these demands together? And in fact, they say they had released about 90 billion as at last year to address all of these allowances. What do you say to this response by the federal government?
Well, all of this can be abated with what we call the CBA, the collective bargaining agreement, which comprises of all health workers, all health unions, with the Federal Minister of Labour, Federal Minister of Finance, and the Coordinating Minister of Health, that's Professor Ali Pate. We've agreed that we'll meet on the roundtable, heads of all unions, to see how we can get this abated. That started sometime last year, halted the process to go and agree that they'll revisit the collective bargaining agreement. The different unions have given their different opinions with respect to the collective bargaining agreement. It's simple. Government should collect all opinions from different heads of union and see how they can work on this simultaneously. So that's just the issue. Once you can sort out the collective bargaining agreement, it means that you've been able to get input from all union leaders in the country across all facets, you understand, of unions in the health sector. So once they agree that they meet on the roundtable, get all input from all union leaders, see how they can marry all issues together, there'll be a way forward. The collective bargaining agreement is the only remedy to this lingering issue in the health sector.
There's also the issue of the government saying some of your requests, in fact, have been addressed. That it was about 19 or so before, but now it's been reduced to 9. So someone might say, if the government is actually paying attention to address some of your demands, do we necessarily need a strike, to see to it that the rest of the demands are ceded to?
Are you also aware that house officers, the lower cadre of doctors in the country, we just added their demand amongst our demands? People that will work for 24 hours.
This is a new demand now. This is a new item on the list.
Yeah, it's an addendum. People that worked more than 24 hours a day, or they work 30 days in a month, and you pay them on the 59th day of the next month. Just like you work, you're meant to get paid between 26th to 29th of that same month. But they get paid on day 50 of the next month. How then do you want them to survive? We are paying that. Why not you just move them to another platform where you can pay them? You see how they pay doctors or other people doing NYSC. Move these young doctors to that platform, pay them 1 month after they've done their work. You see the mirage of assaults on health workers across all facilities in the country. The loot issue is another issue. Among what you're saying, I miss what you're saying. The salary areas, promotion areas, PAT areas, they've been a recurrent decimal. Week upon week, we come in with these demands and appeal to government. Even if you can't pay all, why not pay substantial amount? Why not pay in aliquots? There should be a payment plan for some of these things. Between last year and this year, it's over a year. If there was a payment plan, that in 1 month or in 2 months, I'll pay you this particular percentage. Remember, the Abuja Declaration in 2002, in 2001, that there should be 50% accrued to the health sector. But I can shock you that just in 2024, are you with me?
Yes, please go ahead.
In 2024, what they allocated to the health sector was less than 5%. In 2023, it was 4.2%. In 2025, it was 4.7%. In 2026, proposed is 4.2%, less than the previous percentage allocated to healthcare. That's the general budget in the country. So where are we actually heading to? It is actually alarming.
Yes, and more alarming as well is the level of brain drain, the Japa syndrome, doctors who are leaving the country. Earlier, you tried to give us clarification on, the exact numbers and what we're seeing as a decline now. In your opinion, do you think these issues in the health sector are largely responsible for, this outflux now, permit my use of word, this outflux of doctors, to abroad, US, UK, Canada, and the rest of them? Or are there other underlying factors responsible for these brain drain in the health sector?
Well, for me, I think the unprecedented wave of doctors' migration is due to so many factors, not just remuneration. Can you hear me?
Yes, sir.
Poor working condition, inadequate infrastructure, limited career progression, poor welfare and safety, different factors, even economic factor. So if all of this can be resolved, Nigerian doctors will not leave the country. We love our country, we want to stay here, there's flexibility in Nigeria, but it is because of the above issues I've mentioned that has led to doctors leaving the country unprecedentedly. The workload is now increased. There's longer waiting time for a patient because of the doctor-to-patient ratio, which is abysmal. Before this time, it was agreed by WHO that should be one doctor to over 300 patients. But now you have one doctor to over 15,000 patients because the population in Nigeria and the large number of doctors living in Nigeria in droves. So for me, I think to get these issues resolved, Nigeria should go back to the drawing board and see how they can work on their manpower and see how they can increase remuneration, timely remuneration, not just increase remuneration, timely and competitive remuneration. They should look at what Ghana is doing. They should look at what other countries are doing.
I'm thankful that you had mentioned.
There's also regulate.
Yeah, I'm thankful that you had mentioned the doctor-to-patient ratio. And in fact, that brings me to the question of how these proposed industrial action might affect patients, people who are in the hospital, Nigerians who are under your care. I mean, there are those who would say this repeated strikes. I cannot count, the number of strikes we've seen this year alone. These repeated industrial actions. I mean, are you not concerned that it affects your patients? And those are the same people that you're fighting to save their lives.
Well, doctors, the NARD, I don't think we hate the Nigerian patients. We don't hate Nigerians. You understand? What we are fighting for is for the survival of the healthcare sector, so that they can also benefit from our treatment, from our management. So what if you come to the hospital as a patient and I tell you that the scan I'm supposed to use and scan you to get a diagnosis is not functional? Who then will you blame? Will you blame the doctor, or will you blame the management, or will you blame the Nigerian system? What if you come to the hospital and tell me that you want to do an investigation and then I don't have adequate materials or tools or modern equipment to get those things done for you? Who then will you blame? So for us, it's about quality, not quantity. It's the quality of care you give to the Nigerian patient. So what we're fighting for, we're not fighting for ourselves. We are fighting for the Nigerian doctors. We're fighting for the Nigerian patients.
Dr. Emmanuel.
We also, yes, I can hear you.
I want to appreciate you for your time on the program this morning. But before we let you go, right? So are you saying this strike is the only language you want to speak to the Nigerian government now for them to listen? Is this the only way out?
The only way out is for them to look at our resolutions and see how they can solve our issues. If they solve our issues before August 10, why not?
So
Don't really need for us to commence the strike. If our issues are being handled and resolved before August 10, I tell you for free that we'll abate the industrial action. Nobody's happy to go on strike. You understand? We are only working to protect the Nigerian patients. We are only working for survival. How then will you owe a doctor more than 5 years of his arrears? How then do you want the doctor to pay school tuition for his child or for his children? How then do you want the doctor that lives in Abuja to pay his rent, or the doctor that lives in Lagos to pay his rent of over 3.5 million naira a year? So we are fighting for survival. By next month, there will be resumption. How then do you want that doctor to go to school and pay school fee for his child? Nobody's happy to go on strike. We are only saying that things should be done properly. Things should be managed in their own perspective.
I mean, with all this strike going on over the years, we've seen, doctors come. I mean, in this year alone, we've had that. From last year, we've had that also. Same problem. The demands are not met completely and not be addressed. How do we now even encourage the younger ones who want to be doctors in this country to get even into the system?
Let me tell you, we've given series of ultimata in the last 1 year since this president came on board in Castina. More than 10 ultimata we've given. We write to government, we'll give 2 weeks ultimatum, come back again, we'll give, come back again, we'll give. And then let me tell you, the younger generation are not ready to stay in Nigeria. After their compulsory housemanship training, they write exam and leave the country in droves because they're not happy with the training system in the country anymore. A doctor that leaves or wrap up his housemanship, come back to the system to work, and is poorly remunerated as compared to his classmates. Let me give you the statistics again. I'm on the class page where I graduated from, and a colleague is getting married. A doctor in Nigeria is giving 10,000 naira. Another colleague in the UK and Canada is giving 500,000 naira because he's well remunerated. It is not about goodwill. It's about the fact that here in Nigeria, you cannot even you can't even give your colleague 50,000 naira to support his wedding, or maybe if he lost a loved one or anybody around him because of the fact that you're poorly remunerated. I'm just giving you statistics across board. I'm not being emotional. I'm just telling you how things are being done. You understand? Even on your class page where you belong to, you see colleagues donating money on the class page because they are substantially remunerated. While doctors in Nigeria are poorly remunerated. So these are the issues. How then do you encourage a doctor that leaves medical school 6 months after to stay in Nigeria and practice medicine?
Do you have a reply from the government so far, since you rolled out this warning to say we're giving August 10 and we need a reply? If not, we're going on an indefinite strike. Is there a reply from the response of government, since, I mean, you have your minister, Professor Mohammed Ali Pate now? Do we have a reply from him still?
Well, we left FTH Gombe just last week, right, Friday, after our July NEC meeting. And then today is the only working day. We are hoping that within the confine of this week, we'll have a series of discussions and engagement with those our regulators and those at the helms of affairs. It's actually a simple thing. It's what we've done before in the past. I believe that it is imperative at this point for government to call us to the round table and see how they can get these issues resolved. And once these issues are being resolved, I tell you for free that there won't be any need for us to embark on the industrial action. If these issues can be resolved amicably within the span of today, Monday to Friday, not really for us to embark on strike.
Okay.
If you can't pay everything, there should be a payment plan. There should be a method for you to get these issues resolved. You understand? It's not about just meeting and signing MOUs. You signed memorandum of understanding, you signed memorandum of MOA, memorandum of action, which is implementation.
Right.
You not implement some of these
doctor,
issues.
I guess before we finally let you go, you've really given us a great understanding of the situation. We've had these roundtable talks before. You go back to work, the terms are not fully met. You come back to issue of this threat again. They try to talk to you guys. You come back to work. Why have we not found a lasting solution to clear all of these outstanding once and for all? Why? From your perspective, you understand the situation indoor. You're inside it. You're part of the association. Why do we keep coming back to this same table of negotiations? We round table talk, we talk again, we meet to some demands, and then we come back again, and all. Why do we keep coming back to this cycle?
For me, I think it's insincerity in the part of government. The NARD go to discussion with a sincere and plain mind. We go into discussion with our mind is like a tabula rasa. You understand? Because we go into discussion hoping that these issues will be ameliorated. And we go there, discuss issues, get issues resolved, sign MOUs with timeline. And before this time and this time, that money will be paid. Before this time and that time, whatever it's in the MOU will be sorted and abated. And then we'll wait again for another meeting again, and it's not being resolved. So I think it's just a more of a system failure and insincerity in government. Sometimes you go to tell you there's no cash backing for payment to be made. And I ask myself, what is really wrong? What is happening? Is it that we cannot get some of these issues resolved? When you know that these issues can be resolved amicably, Nigeria is blessed with so many amenities. Why then can't you just sit down on the table, on the round table, and ask yourself, how can we get some of these issues resolved? Issues of remuneration, issues of economic factor, and all of these issues too can just be resolved within the twinkle of an eye.
All right.
If the government is sincere and serious on handling some of these issues.
All right. Thank you so much, Dr. Ogar Emmanuel Idoko, for your time on the program this morning. Thank you for joining us. We appreciate your time. Thank you for giving us your thoughts and making us understand the situation broadly. We do hope that we do not result to a strike, but thank you and enjoy a great week ahead.